Now let's dive deep into this big LGBTQ story for today. I'm Faye Watt, and let's queer up health. Who do we blame when the UN says millions are going to die from AIDS by 2029? Years of U.S.-led investment helped push global AIDS deaths to the lowest point in over 30 years. But today, that progress is collapsing fast. A chilling new UNAIDS report warns that over 4 million people could die from AIDS in the next 3 years and by 2029. The UN says it's because of the sudden U.S. withdrawal of $4 billion in global HIV funding earlier this year. Clinics have closed, testing has stopped, supply chains are broken, and as UNAIDS puts it, a systematic shock has already begun. The damage began when President Donald Trump froze all foreign aid in January and moved to shut down the U.S. Agency for International Development. Though Secretary of State Rubio issued a limited waiver to continue treatment, the future of life-saving programs like PEPFAR remains uncertain. Andrew Hill, an HIV expert, called it irresponsible to cut funding without warning, leaving patients stranded in Africa. In Nigeria alone, 99.9% of HIV prevention drug budgets came from the U.S. Dr. Chris Beyrer from Duke University warned of another massive setback, the loss of data. He said, quote, without reliable data about how HIV is spreading, it will be incredibly hard to stop it, end quote. Meanwhile, a promising new injectable drug, Yeztugo, has been hailed as a game changer. But activists like Peter Maybarduk says Gilead's pricing strategy keeps it out of reach. Quote, we could be ending AIDS. Instead, the U.S. is abandoning the fight, end quote. UNAIDS says hope still exists, but only if the world steps up before it's too late. A major debate is occurring today in Washington from both House and Senate on discussion of what the next steps will be and if the Republican majority will reject Trump and Rubio decisions on AIDS prevention and life-saving treatments. You know, we were this close to ending AIDS, this close. Then Trump froze those $4 billion in global HIV funding, all right? Clinics are shutting down, meds are stopping, and millions are at risk. This isn't just policy, it's life and death. And the U.S. can't preach freedom while turning its back on the global fight against AIDS. And this is where we're at.
I know. We used to call AIDS a global national defense issue, and it was so important. And now this. The truth is that even in the U.S., we aren't doing what we could be doing. That I forget the clinical term for it, but where the suppression of HIV, where you're getting the communities, you're getting the education out, you're getting the prophylaxis out, you're getting the medications out, and so fewer people are seroconverting. Those who are positive have their virus load under control, undetectable. That is down to like 10%. Like 90% good, 10%, still working on in a lot of countries that get this aid. Whereas in the U.S. itself, it's down to 50%. It had been down like to 30, it's now up to 50.
Wow.
So we're not even like educating our own people, and we have the resources, and now we're cutting it off to a world who was taking them and using them properly and really getting their countries healthy, and now this. So this is, I can't see the point of it other than cruelty. I don't see how. I know it costs money, but everything costs money.
Everything.
You have money for a parade, a silly parade where you can't even march in step. You've got money for whatever you want. So why don't we want to keep people alive? Why don't we want families to be healthy and safe? And this is so spreadable. I mean, if people don't know about it and they can't get tested and they can't get treated, families are going to be wiped out. Communities are going to be wiped out.
Completely. Bishop, but how about the possibility of a new strain, right?
Oh, exactly.
Because, and then a new strain coming over to the U.S., which will happen.
Yeah, people travel, and which is what happened to begin with. A flight attendant all over the place, went somewhere, and patient zero. So that's how it started to begin with. But, we can't teach history, and we can't teach anything gay, and we can't teach anything about HIV. And so, yeah, this is not only evil, it's stupid. It's people are going to die needlessly. We have so much research.
Yeah.
And we have so many resources. And why would we not? We really could wipe this out.
Well, how about, we talked about in the story about Yeztugo, which is a new drug, and it's literally just an injectable, right? But what people are saying is that people like Gilead are not going to make it.
Is it twice a year? I think it's yes, but it is cost prohibitive.
But it's expensive. Okay, and that's the thing, so who gives a shit if you have it, if you can't get it in the hands of the people who need it?
Exactly, but if every person at risk could take 2 shots a year, I'm wondering if that wouldn't be offset by you wouldn't have to get viral loads every 2, 3, 4 months. You wouldn't have to take medicine every day.
Yeah.
I'm just wondering if it wouldn't be offset by the benefits. And even if not, some things are worth paying for. Maybe we don't have the largest military on the planet. If we're larger than the next one by, a grillion% or whatever, we can have less of that and still feel safe.
Just like 2% less will be okay.
I just understand what the American aversion is to kindness and compassion. We're so afraid someone is gonna get some benefit.
Yeah.
And maybe everyone could get some benefit. Why is that keeping you up at night?
It can't, and it's something that sparks in me is that another reason why they really don't want to help these people is because of the color of their skin. Okay. And that pokes at me, Bishop, where it's like, screw it. They're in Africa and they're black. Screw them.
Yeah. Oh, we would be naive not to think that. And that it's still associated as a sexually transmitted disease. Yeah. And so there's always stigma with that. Guess what? Sex happens. People have sex. And you shouldn't have to die because you do what people do. People have sex. I'm HIV positive. And back in the day, people would die and they call it liver cancer or leukemia. They were just anything to hide it. And then if they were caught, they were always like doing something heroic and saving someone's life on the side of the road and blood squirting their eye. And at one time I'm saying, am I the only person who got it from fucking? Am I the only one? I used to say, when I think of what I have, I don't feel so great. But when I think of how I got it, I can't complain. But people do it. People have sex, and it's good, and they shouldn't have to die for it, and they no longer have to.
Yeah.
And here comes our government saying, well, sorry about you, but maybe you do have to because I don't like your color, or I don't like your politics, or I don't like your sexuality, or whatever. We have the means to completely, if not cure this, control it for every community on the planet. And it is an absolute sin if we don't try to.
Amen. And that is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.